4 to 7. With Marcus, Mr. TM Romero, Sky 99.5 FM.
Let's jump right into our discussion on oral health. Let me bring to the mic none other than the moment we've been waiting for. Dr. Peters, Tamika Peters. How are you doing there?
I'm fantastic. Thank you.
Pleasure having you back on the inside, man.
Yes, this is my second time.
Is it or the third?
The second time.
Second?
Yeah.
I feel like you're here every day, man. Just kidding. Nice having you again, man.
Yes. So we are here to talk about, getting a great smile.
Yes.
Yeah.
Achieving that winning smile.
Right. So I'm Dr. Peters, Tamika Peters, and I am a teaching assistant at the University of the West Indies School of Dentistry.
Nice.
And for those who are seeing us live on the cameras, I have one of my work colleagues here in studio with me as well, Kareem.
Kareem, yes.
Yes. And, when we talk about getting a great smile, I suppose, you might be wondering if you're going to talk about flossing and brushing, which we are going to do.
Right.
But the first thing I really want to hit on is that when patients do visit their practitioner,
right,
and that practitioner tells them what the plan is, outlined for them, is to follow it.
The funny thing is, a lot of people visit the dentist only when they're in some sort of discomfort.
Exactly.
Not for some sort of a plan.
Yes.
Just to get a teeth out.
Yes.
Or to stop a toothache.
Exactly.
Yeah.
I mean, that is the most common reason why they come. But then when they come, we do a total exam and let you know where other areas are, kind of sketchy and give you a total plan for you to follow. And, dentistry is expensive.
Yes.
I know this.
Yes.
And, one of the reasons why it's so expensive is because dentists in Trinidad, we have to get all of our stuff in from overseas, all of the materials.
So it's all imports?
All imports, except for one company that operates out of Laventille, actually, that makes denture teeth.
Okay.
Everything else is imported, and there's a lot of duties on it, every single material. And so we have to, find a way.
It's a very expensive operational cost.
Exactly. But personally, I think it's cheap compared to the US when I have seen some of the prices overseas.
Right.
Yeah, so just to say that. But when you do come in, work out a plan with your dentist. Let them, ask them if you can pay half down, if you can, pay as you go, and it's very possible to do so because if you just focus on that tooth that is giving you that toothache, that tooth that needs to come out, you neglect the rest of the mouth that needs attention. Yeah, and it's like anywhere else in your body, it's hard tissue, soft tissue, as we call it, and it needs attention. And so if bacteria is there, which is why you have a toothache in the first place, it's like walking around, as I tell patients, if you get a wound or a laceration, and you're going to put a plaster on it, man, Marcus, you're going to clean it out, you're going to make sure it is ready to heal.
I hope that doesn't get any worse.
Exactly. Yes. So why is it? We know why patients, they stay away from the dentist, course being one of them, and dental anxiety being another. But
so, as you say, dental anxiety, a lot of people are afraid of the dentist.
They are very afraid.
The mouth is a very sensitive spot in the body.
It's very vulnerable as well. So you're letting another person into your space, right? A very personal space, and dental anxiety has a lot to do with not knowing what is to come, the sights and the smell of the practice or the clinic or whatever. And maybe sometimes trauma from your childhood where you would have experienced something before and you carry that on. You may not even remember it, but you just know that you're afraid.
Speaking of which, let's talk about the whole quacks, as you were telling me about. Because that could really leave a lasting negative impression on someone.
It can. As a matter of fact, well, first of all, I want to know if Trinidadians are really aware that quacks operate. And so in doing research along the way...
And by quacks, we mean...
Unregistered, dentists, unlicensed.
So guys who just trying a thing.
Yes, you're trying a thing. I'm actually to try really full-fledged operations under that thing, right?
Wow.
You can walk in and get your stuff done. And I would just want to touch on a survey. It's a survey, if you could call it that, questionnaire that Dr. Naidu and Gobin and another person from the UK called Newton, they did in 2003.
Right.
Where they found out that a lot of people do go to quacks and a lot of them are satisfied, not saying no. But the reason that they go, again, is because of cost.
Yes.
Right?
Yeah.
Interestingly enough, as you said, extractions and toothache and so on, the number one reason why they go to quacks as well is for an extraction.
Okay.
Right, and extractions are minor oral surgery procedure.
Right. Because you're removing a tooth.
You're removing a tooth. You're removing and interfering with somewhere that's a part of your body.
Right.
If you remove one hair from your skin, right? So in doing that surgery by someone who is unregistered, you cannot guarantee that they know what they're doing. One, because they haven't studied and done the medicine for it. Right. There are vital structures in your face, like nerves and your sinuses and so on.
So let me ask you a very hard question here. So in terms of removing these teeth, right?
Yeah.
These teeth. if you remove the wrong tooth or maybe make a mistake doing that, could you disfigure your face?
Disfigurement, not so much in removing the wrong tooth. You as the patient might be very irate with dentists that removed the wrong one, and they still have to address the one that they left behind.
Right.
But it's not something that happens very commonly, and it's not something that cannot be fixed. But with a quack, if that happens and you get medically compromised or dentally compromised, the dental council, and this is where I would bring in the council, although I'm not speaking on behalf of them, you cannot get redress based on that because you have gone to some. Yes.
Wow.
The most that you can do is make a police report and hope for the best. But the council itself cannot represent you and get you some sort of redress from the situation. And it's dangerous.
But how do we know when it's a legitimate dentist?
Very good
and when
question.
it's a quack?
Very good. So,
because I'm sure these guys have some nice placards up there.
Well, I haven't walked into the office to see. But just the same way that you would walk into a business, a restaurant, a supermarket, and you see that VAT registered certificate on the wall, you're going to walk in there and look for your certificate of registration. It's going to have the dentist's name, their registration number, and if it's not there, you can ask them if you are registered, or you
can I see a number?
Can I see a number? Or you can call the council office and find out, is this person on your roll of registered dentist? And
you have the contact number for the council on you?
You know, I don't have the council that contact number.
Is there a website that we could go to?
Yes, just type in Dental Council Trinidad and Tobago and it's going to come up on Google. It's actually a fresh and new website that we're working on.
Oh, nice.
Yeah, nice. So that's in the mix. So find out, look for the certification, and don't put yourself.
So would you guys be putting a directory there soon that you can go and scan yourself?
Yes, that is
excellent.
In the works where you could just go and check for yourself, and it's in the yellow pages as well. Even now, And so I just want to let everybody know that they are practicing out there, and you need to really take this is very, really close to my heart. You need to pay particular attention to where you're going, because your dental health is part of your health, even though we may neglect it sometimes. It's part of your health. And
I think because your mouth is so sensitive, that could be one of the most discomforting situation you could be in when it comes to teeth. And
it is.
I mean, a toothache could keep you up all night, and we've all experienced
Some people say it's worse than labor pain. I mean,
I don't really want to disagree with that, no? It can be very, very discomforting.
So let's get to the flossing and brushing, right? So the nitty gritty stuff.
Nice. So we're gonna do the make the smile nice.
We're gonna make the smile nice, right? So we touched on the case completion. So during that whole treatment planning, the first one of the first stages would be getting you to a status of good oral health, good oral hygiene, making sure that you have a good technique to brush and floss, right? Flossing, people, like I've said on another show, you know what show that is. It's like just having a shower and forgetting to scrub some part of right? We need to keep it clean. It's
because your toothbrush can't reach
it
certain
cannot
areas.
reach in between, and it's a place where your toothbrush can reach, but the bacteria are surely getting in there. And when you have your food and your sugars, and it's there waiting to get food to eat as well, and they produce the acids to cause your cavities, right? I'm saying cavities in quote unquote. We actually call it dental caries. It only becomes a cavity when there's a hole. And sometimes you can detect when there's a cavity as well too, right? So flossing is very important. It's also important for your gum health. The bacteria in the plaque, they cause your gums to get inflamed, so you would see the bleeding, the swollen gums. Sometimes you get a bad odor, and that's the next thing. If someone is telling you
bad breath,
wow,
that's a big one.
It's a touchy subject because people like to shy away, but I mean I'm a dentist, yes, but when I have friends, I do say it's only one reason why we get in that odor.
It's only fair that you do so much.
It's only fair. I mean, you in public, you might be a professional and so on.
But what is the number one cause of bad breath?
The number one cause of bad breath is poor oral hygiene. That is the number one, unless you have something really extreme where your gingiva, your gums are undergoing decay. I'm going to say it like that. It can happen. If that is happening very rapidly and there are certain signs that we look for. This is another area.
Right.
Once you're able to get to the dentist really often and we could pick up those signs, we can probably tell you, you know what, you may need to get an HIV test. Right? This is another reason why it's important to go to your dentist, you know, really frequently. We are one of the practitioners within the health system that can identify when someone has HIV and could tell you at what stage based on what we are seeing. Right?
Excellent.
So, in terms of bad breath, yes, periodontitis is what we call it, where the supporting tissues of the teeth are under some inflammation. And that can be simple as gingivitis, all the way up to loss of the gum structure as well as the bone structure. And when you lose bone structure, it's like having a tree that's been uprooted out of the soil. You know, you root in the soil, and the tree is going to fall out because you have that support system being eroded away.
Let me ask you, growing up, I've heard that if you don't brush your tongue properly, that could cause bad breath.
That can also cause bad breath because your tongue, the surface is a little, it's not flat and smooth, right? We have those taste buds in there, and different types of taste buds too, and the bacteria, they do fit in there and can cause.
So mommy was right.
She's right.
There we go.
It's all because of the bacteria, and everyone has it. We just need to keep it clean.
All right.
Yeah.
All right. So do we floss every morning, every night, after every meal? What is the process for flossing?
Every night, and I always tell patients that if you floss first and you loosen up the plaque from in between the teeth, then when you brush it away.
Okay.
Right? And flossing is not just for when that chicken stick in between and the beef filler always a little, you know, pressure cooker to take a long time.
A piece of meat fits
no,
in there.
it's not.
I hear
when you need that floss to actually clean the tooth surface. It's not just to get into the space. So when you go into the space, you clean one tooth and then you come back and clean the other tooth that bounds the space. Yeah.
All right.
So every night, as far as possible, do that before you brush.
Excellent.
Yeah.
So there's another thing that I've heard growing up. They're saying that you have to try to brush your teeth with a very tough toothbrush. If it is that the tooth is if the toothbrush is not tough enough, you might be scrubbing properly. Is that a myth?
That is, well, I don't want to say it's a myth. Very long ago, they thought it to be so, but it's definitely based on the technique. You can use a soft toothbrush and get rid of that bacteria.
So you don't need the scrubbing brush type?
You do not need the scrub. Please go and get rid of the boss in the drain with that one, right?
So could that damage your teeth, though?
It can definitely damage your teeth.
Wow.
It's a hard structure. The enamel, the first layer of the tooth, is the hardest structure in your body, right? But when you constantly do that action on it with a hard toothbrush, you can cut into the tooth.
Wow.
So you actually get cavities. Now, it's not the cavity where it's rotten.
You're making your own cavities.
You're making your own cavities. And when you get that cavity there, the second layer of the tooth, which is the dentine, is exposed now. And patients come and say, Doc, I get in this sensitivity here and I get in it there. And when I can't eat my ice cream and so on. You know, there are other reasons why I get sensitivity, but that is one of the reasons you can.
All right.
Yeah.
In terms of that getting sensitivity, what are some of the signs that you're developing a cavity?
Well, okay, so the cavity where it's rotting, right?
Yes, rotting.
I like that word rotten because I want people to know it rotting, right?
Yes.
So basically, you would the early stages. Now, within the center of the tooth, you have soft tissue, you have nerves, and you have blood vessels.
Right.
And it's encapsulated by this hard tissue, right? When you have a cavity and the bacteria are advancing, they move towards the center of the tooth.
Right.
Now, this is where everything is vulnerable. So you would start to get symptoms like, okay, when I drink something hot or cold, I get a little something and then it goes away.
You get that spiky feel.
I get a spike and it might last for a little while and then goes away once you stop drinking or eating, whatever, right? But then there's a point where it goes beyond that, where your nerves and your blood vessels are so inflamed that they can't go back from where they came from. It's called irreversible pulpitis at this point in time. And because if you could imagine when you get an infection anywhere else in your body, it will swell up and there's room for it to expand if there's fluid and so on. But inside the tooth, it cannot expand because it's encapsulated. And so with that pressure that is building within the tooth, you get that push on the nerves, and that's when you get the pain. And this is the kind of pain now when you're lying on the night. Say, what is this? Jesus needs to come now. And you can't sleep with your head back and it's throbbing and the earache and the headache and all of that. And so that is the point at which, we know things are getting a little dire. But from the early beginnings where you're getting that pain to hot and cold or even when you're biting, possibly, very, very possibly, you have a cavity there.
So immediately you should visit a dentist.
You should visit a dentist. Sensitivity,
Yeah.
pain, anything, come and visit. Let's take a look.
Yeah. So we started off by saying people only visit the dentist normally when they're into some sort of discomfort. But what really should be the frequency of the visits to your dentist?
So providing that you do get the chance to finish your case, all right, and you are at the maintenance stage.
Right.
According to what you would have started off before on the stage where you have reached in terms of your oral hygiene and being able to take care of it, you can come to the dentist every 6 months to do a cleaning, as we call it. Right. And so that way the dentist would pick up on any hardened bacteria, because it does get hard. I know we can look inside our mouth sometimes and see where it's a little yellow and
the color disfiguration a little bit.
Right, and that is where the bacteria has gotten hard, literally like concrete, and we are able to take that out for you, right? And maintain your gum line in that way. If you're doing super and you're a good patient, it means that we can give you a year, come back every year, and you do a review and you do x-rays over to check and see if anything has changed and if anything new has happened, because a lot of the procedures, especially if you do extensive work and you would have done, let's say, root canals, and you have done crowns and bridges and so on, we would love to check that for you to make sure, listen, that money that you spend for that, it's not going down the drain, right?
Excellent. Well, Tamika, time continues to run out on us, and I now would have to keep you for the rest of the evening.
Oh, wow.
Yeah. But is there anything else you would like to touch on quickly before we go?
I have a list of people that I want to big up, right?
Yeah, man. Let's do the big ups.
I want to big up the the UE dentistry crew.
Nice.
And that includes all of my former lecturers and my colleagues there now. Dr. Naidu, who I mentioned earlier on, who did that paper. He works at the School of Dentistry.
Blessings, Dr. Naidu.
Yes, Dr. Rafiq and Dr. Parag, my supervisors and head of department.
Nice.
Yeah, then we move on to the TCC crew, the Trinidad Christian Center crew, my apostle, Austin the Book, Pastor Sudas, Reverend Jackie, and the youth ministry, the young adults ministry, which we pick up the name Christ Representers.
Christ Representers, I like it.
All right.
Nice, man.
And the remainder of the youth ministry as well too, and the We community. We community is very special to me because it's just a group of us who thought our church was really big, and so we wanted to come a little closer. So we have a WhatsApp group and we just lime all day fellowship and we talk to each other,
Nice, man.
Ignite crew. So you know about Ignite Ignite Ministries. We really did that outreach. So I want to big up Stephanie, Dr. Nehemiah.
I haven't heard from her in a while.
Yes, I'll tell her to give you a shout, right?
Sure.
And the rest of the leadership and the Breakfast Club, TT Robin Gale. She said, do not just call my first name, call my entire name. Right?
Robin Gale.
Your
full name was called. It's official.
And Life in Life Ministries, and a very close colleague of mine, Dr. Bissoon. And last but not least, my mother and my brother, my sister. Well, she's all the way in England, but I'll still give her a shout, even though she might hear it. But yes, and everybody else who knows me, the Tunapuna Government Sec crew, the Convent crew, and everybody. I just need to send a little love to you guys and say thank you.
Well,
for
Dr.
being
Peters, thank you so much for sharing a little time with me today.
You're welcome.
Yeah, I will have you back again.
Yes.
All right. Nice. Have a good one. Of course, your news is up next. Your news headlines. So keep it right here. Route 4 to 7. Marcus Romero, Mr. TM.
You're on Route 4 to 7 with Marcus, Mr. TM Romero, Sky 99.5 FM.